Hi guys, welcome back to the channel. So last class we have started with ENUG and we have finished ENUG, that is acute necrotizing ulcerative gingivitis. We'll be starting second lesion today. Okay, let's start. Second is suppurative osteomyelitis. Okay. Clinical presentation and pathogenesis. It is defined as an infection of the medullary portion of the bone that includes the production of pus. So it is the infection of medullary portion and it includes the production of pus. Some or all signs of inflammation including swelling, limited motion, erythema and warmth of the overlying tissue and pain. So all signs of edema inflammation is seen in suppurative osteomyelitis. The most common cause is an incomplete or failed root canal treatment. So the most common cause of suppurative osteomyelitis is incomplete or failed root canal treatment. Other causes are an extension of a dentoalveolar infection including dental abscess and dry sockets or complication of fracture. Mandible is more commonly affected. Occasionally, oral cutaneous, oral enteral or oronasal fistula can be seen. Now, in some cases, bacteria-induced visual thrombosis will create an ischemic neuropathy causing lip paresthesia. Differential diagnosis: malignancies such as squamous cell carcinoma, Ewing sarcoma, non-Hodgkin's lymphoma of bone, or osteosarcoma and multiple myeloma are the differential diagnosis for suppurative osteomyelitis. Coming to the radiographic finding, early presentation will appear as a normal radiographic appearance. If infection continues and progress, then irregular radiolucent pattern with ragged borders developed indicative of bone necrosis and pathologic resorption. So पहले तो जो रेडियोग्राफ होंगे अर्ली केसेस में वो नॉर्मल अपीयरेंस रहेंगे. जैसे जैसे इन्फेक्शन प्रोग्रेस होगा देन इट विल अपीयर as irregular radiolucent pattern with ragged border which is due to bone necrosis and pathological resorption. Some will show a portion of bone separated from parent bone, that is known as sequestrum, and the radiolucent band separating it from the parent bone known as an involucrum. Okay, so two terms are there, sequestrum and involucrum. Sequestrum is a portion of bone that is separated from the parent bone, and the radiolucent bone that separates it from the parent bone is known as involucrum. Okay. Extensive bone infection will lead to a pathologic fracture. Coming to histopathology, marrow contain an inflammatory exudate, mainly neutrophils, loss of osteoblasts with increased resorption by osteoclasts. Neutrophils are the predominant cell in suppurative osteomyelitis. Now, within the spectrum of inflammation, a chronic osteomyelitis may supersede the acute disease or may result de novo from a low-grade infection. या तो acute disease से chronic osteomyelitis हो सकता है या it can appear as a de novo from a low-grade infection. In chronic osteomyelitis, inflammatory component is predominantly lymphocytes and plasma cell. In the early stage, it is neutrophils. As soon as it becomes chronic or it reaches the chronic stage, the inflammatory component which is dominating will be lymphocyte and plasma cell. Okay. Stroma is fibrous. Venous thrombosis is frequently seen. Prominent resting line, because both osteoblastic and osteoclastic activity is going, loss of osteoblast is there, then there is resorption of osteoclast, so resting lines are seen prominently. Now treatment. Approach to all suppurative infection should be with a search for the focus of infection. जितने भी सुपरेटिव इन्फेक्शन है, चाहे वो ऑस्टियोमाइलिटिस और अदर इन्फेक्शन, सबसे पहले फोकाई क्या है इन्फेक्शन का वो सर्च करना है. ओके, विल बी कंटिन्यूइंग द ट्रीटमेंट प्लान पार्ट इन द नेक्स्ट क्लास. टिल देन, लाइक, शेयर, सब्सक्राइब एंड कमेंट. बाय.